One.
Hi, Dan.
Hi.
Hi, I'm Nicole. I'm a level 1 nurse.
Pleasure.
Thanks. I've been assigned to watch you give medications today. Would you mind giving me an SBAR on your patient?
Sure. We got an insulin to give today.
Okay.
So this should be pretty fun for you.
Cool.
Glenn Light. He's 67-year-old male. He has no known allergies. He's full code. He's in room 619. He was admitted for a stage 2 diabetic ulcer, pressure ulcer on the right heel. His secondary to his diabetes mellitus type 2. He is pretty regular. His vitals are all within his normal baseline limits. Just to kind of give you an idea of what his baseline is, he has a 76 heart rate, 96 oxygen, 120 over 70 blood pressure. He is going to be clear on all lobes with his breath sound. Oxygen and ventilation is all on room air. He's normal, within normal limits there. His cardiovascular heart sounds are all within normal limits, equal and even rate and rhythm. His abdomen is active times 4 quadrants. He's all normal there. He voids himself. His last bowel movement was today. It was normal. It was formed. He has a saline lock on his right peripheral forearm. And let's see, he has just one ever so slight abnormality. His HbAC A1C is 6.5, which is just slightly high. His insulin, though, which is what he was complaining about as another reason of him being brought in, was in the 300s 5 days ago. But right now, we've just read it at 290, which is quite high. Via that sliding scale, because we are giving him regular insulin, Humalog to be exact, on his sliding scale, we're going to be administering 6 units of insulin. Okay?
Okay. Why specifically is the client receiving this medication, and what action does the med have on the body?
So he has diabetes. It's type 2, which means we can do a lot of things to help him control it as much as we need. The diabetes, he's not able to produce the insulin that he needs to cope with the amount of glucose that he's taking in. So we're giving him an outside source of insulin to help him with that.
Okay. And when should you question administering this medication?
If he's hypoglycemic, we don't want to give him any more insulin because then he'd have a hypoglycemic crash.
Okay. And does the medication have a therapeutic serum level?
It does. It's 1 to 2 hours after meals is when we're gonna see it, and we're trying to get it to as close as 180 as possible.
Okay. And which vital signs must be monitored, and what physiological parameters should be monitored when the med is being administered?
We're going to be looking at his AccuCheck. I mean, we should take vitals for everything, but we're going to be looking at his AccuCheck, specifically his blood glucose again after we administer the med, to make sure that it has reached back to normal limits.
Okay. And what interventions must be taught to the client to ensure medication is administered safely, both in the hospital setting and at home?
So we want to make sure that he has clean supplies, he rotates sites, and he administers instructions with the time of day that's appropriate for his medication administration.
Okay. And what are the side effects and potential adverse reactions?
So a couple of the adverse reactions is anaphylaxis, which we'll teach him about, and hypokalemia, swelling, and erythema. So we're monitoring closely his hypoglycemia and his anaphylaxis. Okay?
And how will you know the medication is effective?
If there's a drop in glucose level, back to the normal limits.
Excellent.
Okay?
All right.
So before we go in there, we are going to be giving this med. It's right here. I have it. It's Lispro Humalog. This is regular insulin. We want to do our 5 rights and our 3 checks. So we're going to check right now with the doctor's orders, which I have on the computer, and versus the MAR. We're just going to make sure as we pull this med that is the correct patient and the correct time and the correct route, dose, the right patient, route, dose, time, and
Right medication.
right medication, right. So we got lots of rights, and we're going to do our first check right now. So as we pull the med out of the drawer, we want to make sure that the vial is not it's not indicated, it's clean, it's not cloudy, because this one's not supposed to be cloudy. The expiration date is still intact, that it hasn't been tampered with. We're looking for all those things on the vial.
Okay.
We're also going to make sure that he has no known allergies to this medication. We're going to ask him to verify that. So we're going to do that. We're going to check on the MAR that this insulin is within the sliding scale, which it is, and you can see that right here. It says 251 to 300. We're giving 6 units. His last insulin check was 290, so we're going to be giving 6 units of this. Okay. Before we go in the, or right as we go in the room, we want to wash our hands. We're going to state who we are, why we're here, make sure that we provide for privacy. We're going to ask him his name and date of birth, and see what he knows about his med.
All right.
Cool.
Excellent.
All right. So.
Hello.
Hello, Mr. Glenn Light.
That's me. I'm Glenn Light.
Wonderful. So I've come to give you a med today. Do you know what I'm giving you?
Surprise me.
All right, so we're going to do some insulin today. Regular insulin, Humalog. According to your last glucose reading, you were at 290. Do you know what that means?
No.
Okay, so we're just going to kind of go through it with you. I have some wonderful information to give you on glucose right there, or on insulin right there.
Thank you.
So 290 is a little bit high in terms of your serum glucose levels, like how much sugar you have in your bloodstream, right? So we're going to basically kind of help you bring your body's glucose levels back down to an acceptable place, okay?
Okay.
Okay, cool. So I want you to watch out for some things. I want you to watch out for dizziness, cold sweats, and confusion, okay?
Okay.
Those are some of the side effects of this medication that we're about to give you. So if you have any of those, you're going to give us a ring, okay?
Okay.
We're going to be back in 30 minutes to check on you after we give the medication, okay?
Sounds great.
Great. So now we have to get to our first, check.
Okay.
I got to ask you your name
I'm
and
Glenn Light.
your date of birth, and I have to verify it, okay?
Sorry, I'm Glenn Light, and I'm 67 years old.
You are that. Thank you so much.
You're welcome.
Mr. Light, do you have any allergies?
No allergies.
Okay, great. So we just confirmed that we have no allergies with him via on the computer and with him.
Okay.
Here's our medication. We are just going to check it one more time before we draw up, right as we drawing up the med, that we are doing the right med, right route, right dose, right time, and right patient, okay?
Okay.
So let's go ahead. And get the patient ID, okay?
Okay.
So, Mr. Glenn Light,
Mhm.
there's this wonderful number right here that my eyes just can't see, and I was wondering if you can read that off for me.
I would love to.
Great.
Sorry, it's 650
Okay.
255 5339.
Perfect. Glenn Light, you came right up. Thank you so much for verifying yourself.
No problem.
So I'm just going to wash my hands one more time, and then I'm going to apply some gloves so that we can start drawing up this med.
Cool.
Washed hands one more time. And I drew a lot of gloves, so maybe you can have some gloves too if you'd like.
Sure.
That way you can get ready and help if possibly needed.
All right.
Great. These gloves just, I didn't realize I have such giant hands. These gloves are just a little small. I know protocol would say we gotta get some new gloves, but I can shrink them down. All right?
Okay.
So now we have to enter in the medication barcode to make sure that we are giving the right medication here. So we're going to do that. If you'd like, can you read off that number for me, please? Is something funny, nursing
And
one
my
student?
glasses if you need some
Sorry, I can see.
assistance.
D9 BC 98 EB 983651.
Uh-oh.
D9 BC 98 EB 983651.
Ah, wonderful. A green light, which means it's a go. So now I can start drawing up the med. I need to leave the room a second and go get some
Alcohol. Here,
swabs.
well, that's what I'm here to assist you with.
Great,
correct?
so can you go get me some while I wait right here?
Absolutely.
While I'm waiting for those alcohol swabs, I'll just go ahead and start the documentation process by putting my initials in, documenting the time, the date, the
Here you go, nurse.
Thank you so much.
You're very
I really
welcome.
appreciate this. Okay, so first thing we're going to do when we're giving this med is we're going to check to make sure that everything is not contraindicated here, and it's not. We're going to also swab the top of this, scrub the hub if you will. Keep that on there for 15 seconds, just scrubbing away, okay?
Okay.
So after 15 seconds are up, which we have just done, we are going to take our needle after having verified everything, which we've done 100 times, and we're going to draw back, because it says so, 6 units worth of air to inject in the insulin capsule, in the insulin bottle, okay?
Okay.
I just want you to verify that that's 6 units.
Yep.
Perfect. So now we're going to inject 6 units of air. That way we can actually draw back the actual insulin. And draw back 6. Great. Can you verify that that's 6?
Perfect.
Thank you so much.
Mhm.
Now, one of the critical things here is to make sure that we don't recap it with our fingers. So we're going to just slip it in, okay?
Okay.
Now it's just there and ready for our use, okay?
Okay.
So before we administer this, we have to ask him one more time for his name and date of birth and his age,
Okay.
okay? All right, give it to us.
I am Glenn Light. I'm 67 years old.
Perfect. Let me just look at that one more time to make sure. Perfect. Okay.
Okay.
So now we have to ask him a couple more questions. Mr. Glenn, where would you like this today?
I'll take it in my abdomen.
Perfect. That's an acceptable place. All right. We're going to make sure that we don't pinch because it's unacceptable. We're making sure that we're not going to rub in afterwards. That's unacceptable. When we do this, we are going to alcohol swab him, which I'm going to do with this right here. And we're going to, if we do administer it, we're going to hold it for 5 seconds to make sure the drug is fully in there, okay? So, scrub. We have just checked and verified everything over here. 15 seconds have gone by. And we're going to take this back out. I'm going to go at a 90-degree angle, vertically right down and in. And boop. Okay. Right out. Held for 5 seconds. We're going to make sure that we recap using the safe way, and we're going to dispose of said recap, okay?
Okay.
And that is that. How you feeling, Mr. Glenn?
Fabulous.
Fabulous. So we are